Hello, I'm Dr. Poelman. I just wanted to give you a head start on what I'm going to be talking to you about in our visit today. You are here because you have been diagnosed with Hidradenitis Suppurativa, and one thing people ask me is, what is that long word? What is HS? HS is a condition that is an inflammatory condition, so it is not contagious, it is not infectious, it's inflammatory. And it is a genetic condition that is basically essentially there's a genetic mutation in the lining of the hair follicle, such that if you have an abscess or a boil or a pimple, normally you would get a boil and it would get very inflamed and full of pus and gunk and hair and dirt, and then eventually it goes back down, the swelling. With HS, it ruptures, and so you get these almost like rabbit burrows tunneling underneath the skin. So a lesion that looks this big actually is like this big. So these lesions are a lot larger than they look, and this is what makes HS such a challenging condition to treat. HS is oftentimes misdiagnosed. Patients will go to their family doctor and they will get injected with either cortisone, or they'll drain the lesion and get put on antibiotics. And then the next time they get a flare, they'll go to emergency room and they'll get injected, drained, put on antibiotics. And for a long time, we really haven't had anyone say to you, this is what you have and I'm going to take care of you and treat this. The average time to diagnosis for HS is about 9 years. So we're glad you're here today. This is a safe place. We are a center of excellence for HS, and we want you to know that we are going to look after you. Some things to know about how HS is treated. It's kind of like spokes on a wheel. So there is the genetic component. There's nothing that you can do about that. But other things that influence HS are smoking. Smoking can make HS worse, so if you can quit smoking, that's very helpful. And we do have a partnership with co-op pharmacies, which will tell you about the co-op hub. If you sign a release, then they will call you and tell you where the closest co-op pharmacy is that has trained pharmacists in HS who can provide support with smoking cessation, also with diet. Diet is another one of the spokes on the wheel. We know that an HS patient will do better with a low glycemic index diet. Also, some dermatologists tell their patients to avoid dairy. That may or may not be helpful, but I definitely tell all my patients to avoid skim milk. But some will say no white sugar, white flour, white milk. Basically, I believe the most evidence in terms of diet is for glycemic index, so sugar and carbohydrates. So to try the keto diet can be helpful for some patients with HS. Another thing spoke on the wheel is hormones, and so especially for women who have flares around the time of their period, we can talk about anti-androgen or birth control pills. There's a blood pressure pill for women who don't want to be on the pill that's designed specifically for acne or HS. But if your disease is mild, that can be very, very helpful to control the hormonal aspect. I mentioned HS is an inflammatory disease, and so anti-inflammatories are the kind of centerpiece of how we treat it. So we will talk to you about antibiotics. Antibiotics, we use them, again, not because there's an infection, but for their anti-inflammatory effect. If we treat you with 3 months of antibiotics, then you would qualify for the more potent anti-inflammatories, which are, there's only actually one approved right now in Canada, and that's what we call Humira. And I kind of make the analogy of it's an avalanche of inflammation sometimes for people who have a lot of inflammation, a large burden of disease, more advanced HS. We need an equivalent treatment, kind of like a dump truck. And the Humira or the biologic medications are the dump truck. And we'll talk about whether that's appropriate for you with your stage of HS. A very important part of treating HS is surgery. There's de-roofing surgery, where if there's one lesion that it keeps coming back to that same area, what we can do is we can go into that area, we freeze it up with local anesthetic, and then we clean out the area surgically. It's called de-roofing. We let the area heal in secondarily. Dr. Lauren Lamb does that at our center at Beacon here, and we can talk about de-roofing surgery. Please ask me about it if you have one lesion that there's one area where the HS keeps coming back and you keep having flares in the same location. De-roofing surgery would be a great option for you. Prior to the de-roofing surgery, we do have you go on antibiotics or the more potent biologic therapies just to calm everything down so you have a better result with that de-roofing surgery. What are some other things that you can do for HS? So laser hair removal is effective for HS, and we do offer it at our center for 50% off for HS patients. There are some clothing lines that are good because they wick the moisture away from the skin, like NYX clothing and Hydra Wear. You can check out those. There's links to those sites on the Canadian HS Foundation website. Also, another tip that we've learned about through patient support groups that we're involved with is Head and Shoulders. Head and Shoulders shampoo to wash the areas where you get HS can be very helpful, patients tell us. And you will probably get a prescription from me. Everybody who has HS, I like to start them on zinc supplements with copper. And you take zinc with food because it can upset the stomach. And the copper you take at a time separate from the zinc. And that's to prevent anemia. And the zinc is over the counter, but I will give you a prescription for that so you remember how much to take. Another thing that's helpful is resorcinol cream, and I'll give you a prescription for that. That's a cream that is compounded, and we have a compounding pharmacy here in our building, so we will also give you a prescription for that. Finally, some resources that you can look to for your HS would be, as I mentioned, the Canadian HS Foundation. It's www.hsfoundation.ca, and we'll give you a bookmark. On that website, there's a link to a free ebook where they go through everything really about HS. So lots of frequently asked questions from a patient perspective. And there are also links to patient support groups that are very, very helpful. There are two things that I tell people to remember about HS. One is it's inflammatory condition, not infectious. And the second is that there's hope. And you're not alone. The final thing I want to say is that if you do have an HS flare, we're here for you. We have a policy at our clinic to get HS patients in within 1 to 2 clinic days if you're having a flare for an injection of cortisone. So do tell the person when you call that you're an HS patient, and they'll try to squeeze you into our schedule. The cost for the injection is $50, but that will reduce the pain that you're having from the flare and help it to go down faster. Thanks so much, and I look forward to talking with you in a few minutes.